as a standard of professionalism within the professionalism program. It can't be used by hospitals or insurance companies or groups or lawyers or anybody else. It can only be invoked by a member of our profession or by a group of members of our profession to address issues within our profession. To date, we've been unsuccessful at convincing the Academy to adopt this proposal as part of its professionalism program. Some leaders in the Academy feel that they shouldn't adopt programs or proposals or positions that aren't already accepted by 95% of the membership. But we think that situation offers an opportunity to demonstrate true leadership, because it takes no leadership to adopt a position that's already accepted by the majority of the membership. The true leader adopts a position dictated by his or her conscience, as determined by his or her values and his vision for what the society should do. And then he uses his or her skills to educate and motivate and communicate that vision until everybody else sees it too. That's not an easy thing to do, and there's no guarantee of success. We may fail. Those of you who know the OTA presidential line, you know that we're not people who like to fail. We are not used to failure, but we're willing to fail in this attempt because of the importance of this issue. What we're not willing to do is fail without attempting it. So I'd like to ask for the help of everyone in the audience today in this initiative. Those of you who are orthopedic surgeons and members of the Academy, you have a Board of Counselors representative. You may not know who it is. It's usually somebody appointed by the State Orthopedic Society, but it may be you. And you may be leaders in your own State Orthopedic Society. Contact the Board of Counselors. Contact the leadership of the Academy and let them know that this is an important issue to your patients, to your community, and to your practice, and that you're calling upon them to lead our profession in the direction that we need to go. We're a small society. We don't have very many members in the big scheme of things. We have less than 1,000 members. But our members are dedicated and hardworking and well-respected, and I think influential beyond the size of the OTA. And I think if we work together, we can turn the tide of this thing. Speaking of being a small society, one of the things we've learned over the past year is the essential importance of collaboration and of working together with allies to achieve our goals. Our true allies is any person or organization who is dedicated to the optimal care of the trauma patient despite their training or background. Toward that end, I would encourage every member of the Orthopedic Trauma Association to become involved in other trauma organizations. Get on the trauma committee at your hospital or your trauma center. I know that the committee meeting is always at 2 o'clock in the afternoon and you're busy doing other things, and most of the agenda is taken up with what type of blood warmer to get to the ER. But these are important places where policy decisions are made, and we need your voice at those tables. I'd also like to encourage you to join the American College of Surgeons and become involved in the regional committees on trauma. Investigate organizations such as the American Association for the Surgery of Trauma and the Eastern and the Western Association for the Surgery for Trauma. Consider joining those organizations. Important decisions and important social and political actions are taken on those organizations. Investigate whether your trauma center has a chapter of the Society of Trauma Nurses and make some connections there. Because I think although our society has grown up in the House of Orthopedics, and the American Academy of Orthopedic Surgeons is still our strongest and biggest ally, we also live in the House of Trauma. And there are many issues where our voice can be amplified by alliances outside of the strict profession of orthopedic surgery. So I'd encourage you to do that. And while I'm talking about other organizations and the American College of Surgeons, I'll make a few comments about the specialty of the acute care surgeon, which has been an issue of some concern over the past year. As you know, we were initially skeptical and cautious about the proposal to develop this specialty of the acute care surgeon, particularly when it comes to the care of musculoskeletal injuries. Paul Turnett and Mike Bossi were engaged with the process, and the curriculum that's been published includes relatively little musculoskeletal care, things that we feel comfortable with. But rather than spend our energies on pointless turf battles and arguing about who's best qualified to do a certain procedure or treat a certain process, we need to keep our attention focused squarely on the priority of providing the optimal care to the injured patient. And the basic prerequisite for providing that optimal care is a provider who's willing to show up and do it. Once that standard has been met, we can work with that provider. But if that standard's not met, we can't. I'd like to turn my attention away from those issues now and talk about a couple of other initiatives that we've started over the past year in the OTA. You've just seen a wonderful symposium on fracture care in the developed world. This is an important priority to the board of directors now, and we see this as a great opportunity to expand our mission of education and research and quality of care to the huge number of patients worldwide and have an effect on the tremendous burden of musculoskeletal injury worldwide. We formed an alliance, as you've heard, with Lou Zirkel's SIGN organization, which allows us to provide our educational content to the SIGN surgeons in his 130-plus programs in 40-some-plus nations around the world. We've opened our membership to SIGN surgeons who meet our other membership criteria free of charge, understanding that the resources aren't necessarily there for them to pay membership dues. And we have our first 2 SIGN surgeon visiting scholars here today with us, an ongoing program that will continue every year. One of which is my good friend Dr. Lele from Eldoret, Kenya. These are individuals who do orthopedic trauma surgery very well and under conditions that would make most of us drop our instruments and run screaming from the room. So they are truly our brothers and sisters around the world. Dr. Zirkel and Dr. Templeman have made some connections, and as you've heard previously, in Doctors Without Borders. Many of our members are involved in orthopedics overseas, and many others are involved in other humanitarian organizations. We think this initiative is a great opportunity for us as an organization and for us as individuals to, yes, teach, but also learn and to study and to have an impact and to get the rewards of personal fulfillment that you get from providing care to somebody who otherwise would not get it. We've continued to expand our efforts to study and improve the care of victims of combat-related injury through the efforts of our members such as Roman Haida and Andy Pollack and Dick Kyle, Mike Bossy. We've become involved in and initiated the Distinguished Visiting Surgeons Program, which provides senior civilian orthopedic traumatologists to the Landstuhl Regional Medical Center in Germany, where our injured soldiers, sailors, and airmen are evacuated from Iran and Iraq. This has been a very successful and mutually beneficial program. We have been involved in the development and review of orthopedic trauma research program proposals through the Department of Defense, and we've advocated for increased funding for this vital program. And we've been involved in studying and communicating the results of treatment through the Extremity War Injury Symposium, which has occurred twice, and the third time will occur in January in Washington. We see this as an important role of this organization to harvest something good in terms of improved care from this tragedy of conflict-related injury that seems to be spreading around the world. I mentioned our educational mission and how our organization sets the bar in terms of orthopedic education. In addition, we are the envy of many subspecialty societies in our research endeavors. Our research committee, under the leadership of Joe Borelli, has built upon past successes from former chairmen such as Ted Miklau, Mike Bossy, and Mark Swinkowski. We are going to award over $500,000 worth of funds to high-quality research projects this year. Joe tells me that not only are the number of projects going up, but the quality of the projects is steadily increasing every year through the efforts and mentorship of many, many members of the OTA, to whom this is an important value. The OTA has always been a leader among subspecialty societies regarding participation in the OREF, both in the percentage of our membership that participates and in the dollars per member. And in recognition of that fact, the OREF has initiated a new program that's really just for us, that basically says that any OTA member who makes a contribution to OREF, a portion of that donation will come back to the organization to be dispersed through our research committee.